Attention deficit hyperactivity disorder, otherwise known as ADHD, is one of the most common psychiatric disorders in children and adolescents. It's traditionally defined by behaviors like inattention, hyperactivity, and impulsivity.
However, studies are showing that up to 75% of ADHD patients also have a coexisting mental health condition.
We're here in St. Louis, Missouri, home of the iconic Gateway Arch, to explore the complexities of ADHD, and we'll also hear from a very special young lady about her journey from adversity to advocacy. I'm Ereka Vetrini. Access Health starts now. Living with ADHD can be challenging for all members of the family. Decades of research now suggests that ADHD is often just the tip of the iceberg, with so much more going on beneath the surface. There are developmental complexities and overlapping mental health conditions. I wanted to learn about this growing evidence that there's often more to ADHD, so I traveled to St. Louis to meet with members of Team ADHD, a group of psychiatric healthcare professionals united by a mission to advance ADHD treatment. I'm here at First Rule Studios in St. Louis, and here to help us learn more is a member of Team ADHD, Dr. Greg Mattingly, Associate Professor at Washington University and President of the Midwest Research Group. Welcome, Doctor. Thank you so much for joining us.
Thank you for having me.
So you've been taking care of families with ADHD for over 25 years now. How do you help them understand ADHD?
First of all, many of the families that come in to see me have a lot of shame, have a lot of guilt, frustration, anger, feeling overwhelmed. So helping them to understand that, this is a highly genetic neurologic condition. We know more about the neurology of ADHD than almost any other condition in medicine.
Really?
So helping them to step back and understand that your child's behaviors are due to an underlying neurologic condition. And so taking away some of the guilt, taking away some of the blame. No one asks to have ADHD. And a lot of my parents that come in are doing a great job. They just don't understand how their child is wired a little bit differently.
And so when they're coming to you with these complaints and frustration, what are some of the symptoms that they're dealing with their children?
So common symptoms of ADHD for a young boy would be things like being fidgety, being restless, having a hard time sitting still for long periods of time. Pretty common both in boys and girls is getting distracted, having a hard time staying focused, and in particular with girls, many of them don't have the restlessness, the hyperactivity. So for girls, it may go on longer before they get the diagnosis.
Some of these behavioral symptoms like inattention or hyperactivity, these sound like common behaviors of many children. How do you know when it is more?
We have all had some of these symptoms. A little bit of a hard time focusing, getting a little distracted, feeling a little restless. But for these children and these families with ADHD, it's an ongoing pattern where they have these symptoms. The symptoms don't go away.
Right.
And it's not just symptoms. It's symptoms that are causing impairment.
Understood. So tell me about this idea of complex ADHD.
So for years we've talked about ADHD as in these symptoms as you talked about. Being a little restless, being distracted, having a hard time staying focused. And what we know is that about 75% of our patients with ADHD have ADHD plus other conditions stacked on top of it. It may be ADHD plus a learning disability. It may be tics and twitches. It may be depression. It may be anxiety. But it's ADHD along with these other conditions. So complex ADHD is the scaffolding of all of these things that are built on the foundation of ADHD down here, but everything that over time starts building on top.
Such a good point, and we have more to talk about, but we do have to take a short break. Coming up, the consequences of undiagnosed and untreated comorbidities in ADHD.
I've lived with ADHD my entire life, even before I knew what it was. My name is Danny Donovan. I'm 28 and I live in Omaha with my husband. I'm a graphic designer and I make ADHD comics. Some of my earliest memories, it was the first day of first grade and I got my first pair of safety scissors and I wanted to cut my hair. So I just grabbed a piece and went like that. I had no impulse control and I had this dumb looking hair because I made the impulsive decision to do that, and I was the weird girl, day one. I was day one at my new school. That decision let other people think something about me of like what kind of person would do that, and then I kind of got pushed to the outskirts. I was having trouble making friends at all. I used to sit on the curb at recess with my imaginary pets. And recess is usually every kid's favorite, and it was my least favorite because it made it very apparent that I didn't have anyone, and I'm just feeling like an outsider watching everybody having fun. That's because something's wrong with me. They don't like me. Why would they? I don't like me. And starting to have those feelings when you're 6 and 7, you're not necessarily putting together all of the facts, but you just get that feeling of isolation. I was in the principal's office all the time, getting demerits for things that I thought were completely unfair, because I wasn't even turning in homework late. I wasn't doing things wrong per se. I just was being really disruptive. Getting in trouble for not raising your hand or for taking too long to come back from the bathroom because you decided to take a walk around the school instead of coming back. Getting in trouble for stuff like that confused me. I remember when I was younger just feeling things so deeply, sitting in my room and being frustrated at myself. Crying out of frustration was a huge thing for me. I put a lot of pressure on myself as a kid to be a great student and be a great example, and thought if I could be, good enough, and maybe I would like myself. It was really hard for me to not blame myself, be perpetually angry at myself, feel stupid, even though I knew I wasn't stupid. I was still getting good grades, but I needed to get a good grade on everything. So looking back on my school years, I think it's apparent that the reason that I got missed was because I wasn't visibly struggling the way that a lot of kids with ADHD visibly struggle in school. When one of my teachers in 5th grade was even asked about it, if there was a possibility that I could have ADHD, she said, literally, she's too smart. She can't have ADHD. I had no idea how much of an impact it was going to have on the rest of my life.
Welcome back. I'm here with Dr. Mattingly, and before the break, we were discussing the complexities of ADHD and the impact ADHD can have on the entire family. So then, Doctor, I have to ask, how is a diagnosis finally made?
Many of our families come in because they've had a crisis. Their kid's gotten in trouble at school, they're falling behind in their grades, maybe they've just fell into addictions or something of that nature. So taking a look at the crisis, but then stepping back and saying, what are the symptoms underneath it that have caused this condition to develop? So it's 18 symptoms that have been there since childhood and have persisted. We look at those symptoms and how they clump together, and the wonderful thing is we have pretty good rating scales these days that a family can take home and they can sit and think about their child and say, where does my child fall on these different questions? But those rating scales can give you information about how does this affect the child across the day? How does it affect them at school, at home, on a soccer field, maybe on the weekends when they're out with others? So you get a full picture of what's going on with the child to make the right diagnosis.
So then, doctor, what are the consequences of going undiagnosed?
A delay in diagnosis puts our children at risk for a variety of life consequences. Demoralization, low self-esteem, eventually drifting maybe into the wrong peer group. If you don't feel good about yourself and you feel like you're always in trouble, you may not choose the best group to hang out with. And then life goes down a very complex journey. As our children go into adolescence, maybe trying to hold their first job and having a hard time focusing there, distractibility, feeling overwhelmed, maybe blowing up with your boss because you can't modulate your frustration and temper. Driving your first car. We know that our adolescents with ADHD are at increased risk of having a car accident, at increased risk of winding up in a trauma center. And then finally, when we talk about things like unwanted teenage pregnancy and drug and alcohol abuse, we know all of those can be consequences of a delay in getting the right diagnosis.
So I understand there was a study that talked about the consequences of a late diagnosis.
There was a study that came out just recently in JAMA that looked at what happens over time with ADHD as we start building these comorbidities. And so what we found is that ADHD itself wasn't just a set of symptoms, but it was a set of symptoms that increased mortality rates. And so mortality rates due to trauma and injury were higher in individuals with ADHD. As they built comorbidities, we saw those mortality rates rise. So by the time you had 3 or 4 comorbidities, maybe depression, maybe substance abuse, maybe insomnia, we saw that the mortality rate for people with ADHD was 10 times higher than the general population. So comorbidities build, life consequences build, but mortality rates increased. So when we talk about the need for an accurate diagnosis, getting the right diagnosis, but then getting our patients on the right journey in life.
All such good information. Doctor, I can't thank you enough for your time and your insight on the complexity of ADHD. We're going to check back in with Danny, whose delay in diagnosis drastically impacted her teenage years. Let's take a look.
My dad got a job in Phoenix, and so we moved down there, and it was a big change. It wasn't just moving schools this time, it was everything was different. The kids I was in school with were different. I found myself getting really depressed. I didn't feel challenged in school anymore. They were a year or 2 behind, so I was repeating my classes from 6th grade. I was feeling like I didn't have anyone. I got to the point where I was just thinking that nobody would even notice if I was gone, and I don't think anyone would care. I just was so gone. I checked out. I didn't think that my life was worth living, and I'd kind of planned out how I was going to end my life. And I was 13. And so the next thing I know, I'm in therapy and getting diagnosed with depression, and we ended up moving back to Omaha, and I did start to get treated for that and some other underlying conditions. My freshman year of college, I was getting really, really homesick. I started the semester off with some pretty awful realizations, which was that the structure that my parents had put in place wasn't there anymore. I was struggling with some of my classes, and I was not used to that because I was a pretty great student. I wasn't finding any place where I could focus on doing my homework, so I kept staying up really late and pulling all-nighters. I was burning out so fast because I didn't have anyone there to tell me to slow down, and I knew that I needed to get some help.
Living with the complexities of ADHD can be a challenge and can look differently in all ages of children and adolescents. After diagnosis, the best treatment for ADHD is based on a multifaceted approach, which includes both medication and psychotherapy. Let's go now to another member of Team ADHD, Dr. Rakesh Jain, clinical professor of psychiatry at Texas Tech Health Science Center in Austin, Texas.
ADHD is a complex condition. And if you, as a clinician or as a family member, have an individual with ADHD, it's an individual with ADHD with their own unique set of needs. Therefore, the goal always ought to be to create an individualized program for every kid, every adolescent. Not only that, it's really important to think of the treatment as being not just one thing. It ought to be multiple things. Often it's medications, often it's non-medication therapies, often it's family interventions or school-based interventions. Multifaceted is a phrase no one should forget when you're thinking about ADHD. And these are not just my opinions. These are the treatment guidelines.
I got diagnosed my freshman year of college. That light bulb moment of really realizing that, oh, it's not just one thing. I could have multiple things going on. I had these preconceived notions of what ADHD was. It looks completely different on me. Getting that diagnosis, having the depression and anxiety, mood issues, and ADHD, kind of understanding how they can all fit together made it easier to figure out how to treat them all together. As time went on, I worked with my doctor and my therapist to come up with a multifaceted approach to how I was gonna kind of tackle my ADHD symptoms. And this included, medication. I got another therapist who recommended art therapy. And now I found out about ADHD coaching. So I've had an ADHD coach for almost a year now, and it's been helping.
The individualized plan requires that we decide what are the pharmacologic treatments to offer this particular patient and non-pharmacologic. And it is always both. It's never one or the other. When it comes to pharmacologic treatment, we are blessed. We're blessed with so many different options. So when I sit back and think about this particular patient's individual needs, I can choose between stimulants and non-stimulants. But the questions are always the same no matter what the treatment is. Is this the best mix of efficacy and tolerability I can offer the patient? Can I cover the symptoms 24/7? Can I give something that will not just make a meaningful impact, but it's a medication that the individual will keep taking? It takes a village to raise every child, but a child or an adolescent with ADHD really needs a strong village. So often I will involve a therapist along with the medication treatment I offer to offer parent training. Now, parents are loving, caring people, but sometimes when ADHD arrives in the family, they, without meaning to, sometimes create behaviors that don't help the ADHD. A therapist who is well-versed in ADHD can really address that and help the system heal. That's very important. The other thing I often do is request social skills training, because having ADHD for a long time, which is what most kids have had it, often creates a pattern of maladaptive social behavior. So for example, they have learned to shun friends. They have learned the art of pushing people away. So we can address that. And let's not forget the great importance of school-based interventions. So often in school, the kid maybe sits closer to the teacher. Maybe there's a daily report going back and forth between the teacher and the parent. That can be very helpful. Maybe there are other academic adjustments can be made. Another form of intervention that is really rapidly becoming popular is obtaining ADHD-centric coaching. And if you think about the coaching model, it essentially is education, but also support and also encouragement to practice, how to be more organized, how to improve your interactions, how to avoid distractions. These are all skills. So the way to live with ADHD is to coexist with it, not to just hate it, but to look for things you might be able to get out of it that are positive, so that you, the person with your strengths, can fully flourish and be the person you were destined to be.
So I completely fell into ADHD advocacy by accident. I was talking with some coworkers about therapy and told them about my ADHD, and it just ended with this inside joke about how I tell stories. And I turned that into a little flowchart. And then I posted that flowchart on the internet, and it blew up. I had so much amazing feedback and so many people reaching out to me that I feel understood, I feel seen. I didn't realize I've been misunderstood my entire life. You're putting things into words that I didn't have. So I really found out that people were using these. They were sending them to loved ones. They were taking my thoughts that I just drew to process on my own and were showing them to their therapists, saying, this is how I feel. I just feel so thankful that I've kind of stumbled accidentally into this entire world of being a voice for people who have felt voiceless for a long time. Just helping share that message that a lot of people fall through the cracks because it's not just attention deficit. It's so much more.
I'd like to thank my guests for all of their time and their insight. And remember, if you or someone you love is living with ADHD, you are not alone and there is help. For additional resources on everything we discussed today, you can head to more-to-adhd.com, and of course, you can always head to our website at accesshealth.tv. See you next time.